So, my name is Samuel Chigamba. A presentation will focus mainly on the Epilepsy Warriors Foundation and our work. The Epilepsy Warriors Foundation is an independent non-governmental organization which is based in Blantyre, Malawi, and our motto is bringing epilepsy out of the shadows. The foundation was established in the year 2018 by persons with epilepsy and is also run by persons with epilepsy. We established it so that we could be able to address the urgent and pressing needs of persons with epilepsy. At first, it was called Epilepsy Rights Foundation, which was later changed to Epilepsy Warriors Foundation. Our vision is for people with epilepsy to receive proper health care, support, public respect, understanding, and coexist in harmony with all other people. And our mission is to promote human rights, epilepsy awareness, and inclusive societies. Mainly, EWF is committed to raising epilepsy awareness and also advocating for the rights of persons with epilepsy. Yes, so this photo you see there was taken during an epilepsy clinic at Queen Elizabeth Central Hospital, where we do we sensitize clients whenever they are receiving their medication. Yes, so over the past we've conducted 48 visits to the clinic in the past 3 years. And during this time, we've reached about 3,000 people with epilepsy from Blantyre alone through the epilepsy clinic at Queen Elizabeth Central Hospital. Yeah, this next photo was also taken at Queen Elizabeth Central Hospital during an epilepsy clinic, which happens every Friday. Yeah, so it was taken at a time when we were packing epileptic medication. The clinic has about 4 nurses, and looking at we see that it's understaffed. So what we do is we go with our volunteers, we assist them in packing the medication, while other volunteers to sensitize the clients. And at the same time, we also try to identify and document cases of disability related cases, or what we call human rights violation cases. And we also collect statistics on persons with epilepsy from Blantyre. Yeah, this next slide shows pictures of community outreach meetings. What we do is that we sometimes go out to communities to sensitize them so that they should have an understanding of what epilepsy is, its causes, and also know the appropriate seizure first aid. And we also encourage them to seek treatment from hospitals. Yeah, this slide is of an activity which we have a program which we call Be Epilepsy Smart. The aim is that we want every person to know what epilepsy is. So during this activity, what we had was we were orienting school authorities, mainly teachers, on what epilepsy is, how to perform the appropriate first aid for seizures, and yes. So currently we are working in 3 educational zones in Blantyre, both Blantyre two education zones in Blantyre urban and 1 in Blantyre rural. We have conducted about 10 epilepsy orientation sessions with teachers. I'm moving to the next slide. Apologies, I think my laptop is slow. Yeah. Yes. So another thing that we're trying to do is to get corporate companies involved in our work. The pictures you see in front of you were taken during Purple Day this year. These pictures were taken. We had an information session with Finca, this money lending institution, and we encouraged their staff to wear purple throughout Malawi in all their 24 branches. Staff were encouraged to wear purple, and we had to go to Blantyre at one of their branches to do this information session. Afterwards, we distributed 400 flyers to all their employees for all their branches, and 24 seizure first aid posters were also distributed for all their branches to hang on their notice board. Yeah, and we've also conducted one access audit. It's the first audit we've conducted so far, and we conducted it in the offices of Finca, and we did an assessment, and we are about to send recommendations. Mainly, we just want to assess the environment, the work environment. If, for example, a person with epilepsy has a seizure in the workplace, or is a customer, would they be able to assist that person? And afterwards, we also train them depending on their needs. Then lastly, what we're going to do is we're going to give them a certificate to hang on the offices, so that the clients can be assured that maybe in a situation that they have a seizure, they will be well assisted. Yeah, another thing that we're doing is that we formed an epilepsy club at one of the secondary schools in Blantyre in early January. What we're trying to do is to have young advocates. We want the learners to speak on behalf of their learners. They should know what epilepsy is. They should do they should know how to perform the appropriate seizure first aid. And we also received a human rights kit from the Youth for Human Rights International, which we shared with the club. The club has about 104 members who are all learners from the school, and they have a patron and an assistant who is also a teacher at the school. Yeah, and earlier this year, we sponsored a nurse who is based at Queen Elizabeth Central Hospital to go for the assessment and management course, epilepsy assessment and management course, which was by Pretoria Health Global. And this was done through support from our supporters locally and international. And we've been also going through capacity building. We partnered up with Epilepsy Scotland late last year, and we've had trainings with our staff, executive board members, and some nurses from Queen Elizabeth Central Hospital also join us in these meetings. And our youth have also been had a meeting with youth from Scotland, which they shared their experiences with epilepsy, motivated each other, and even exhibited their skills, what they're good at doing. And for example, on our side, some showed they've been doing some crafting, and yeah, I think. Thank you very much for listening. That's all.
Okay, you're welcome. That's quite a beautiful presentation. We've listened to the two beautiful stories here, the one from Chanta and the one from Samuel.